Good afternoon. As of 2 p.m. today, there have been 4,686 positive cases of COVID-19 in Missouri, including 133 deaths. Over 48,000 Missourians have been tested so far. As I said yesterday, we greatly appreciate Missourians' commitment to following our Stay Home Missouri order, especially over the holiday weekend. MoDOT's latest traffic update showed a drop in traffic volume from last Sunday to Easter Sunday. This shows Missourians are listening and doing the right thing, and we're very grateful for that. Today, Director Carson is here to give us an update on the PPE and the St. Louis region on the alternative care side. Director?
Thank you, Governor Parson, and good afternoon, everyone. Yesterday, I announced that the State Emergency Management Agency was recalling an important piece of PPE that had been delivered to law enforcement and fire safety agencies across the state. The recall involved 48,000 KN95 masks that went out to first responder agencies on April 2nd and April 8th. We recalled those masks because testing conducted by the Missouri Department of Health and Senior Services showed that the masks did not meet quality standards. We know how important all PPE equipment is to protect Missouri's first responders. I said yesterday we would continue to pursue respirator masks that would give our local safety partners protection against the coronavirus. And in the last 2 hours, the Federal Emergency Management Agency has confirmed that a shipment of N95 respirator masks manufactured by the 3M Corporation in the U.S. is being shipped to Missouri as we speak. The first FEMA shipment is 200,000 N95 respirators. They're scheduled to arrive at our warehouse later tonight. And, as is our practice, we will work to get those out to first responders as quick as possible. As Governor Parson and I have stated since these briefings began, PPE is one of the most difficult issues we're facing now. Not just in Missouri, but all states. The federal government and private hospitals and healthcare facilities are facing extreme supply problems. And the N95 respirator masks are the single item of PPE that is most in demand. Missouri and everyone else are seeking out these masks. There's too little product and too much demand. The supply chains have broken down. There have been quality issues, and there have been cases of fraud and counterfeit products in other states. All these things mean that supplies will be short, but I promise that we will continue to pursue and acquire as much reliable PPE as we can get, and we will continue to distribute it equitably across the fire service as well as law enforcement and our healthcare safety partners. I want to briefly give you an update on 3 other areas. Yesterday, our alternate care site to support hospitals in the St. Louis region came online. Today, more than 35 medical personnel from the Missouri National Guard and SEMA's Disaster Medical Assistance Team are staffing the site and establishing care procedures in case they are needed. Meanwhile, the Guard and other members of our alternate care site working group continue to evaluate additional alternate care sites around the state. We hope another site will not be needed, but we must be ready. Preparedness is also why we continue our effort to recruit additional members of the Disaster Medical Assistance Team. Since this recruitment effort kicked off 10 days ago, more than 1,000 people have applied, and DMAT has already added 75 qualified professionals to their roster. Finally, our SEMA Recovery Division is working to support local agencies, local governments, and nonprofits as they begin the process of applying for federal disaster assistance. We know the cost of responding to COVID-19 is high and will remain high, and that's compounded by the drop in tax revenues that's occurring. So this assistance is vitally important to local governments and our Missouri economy. As of this afternoon, almost 400 Missouri public entities have filed the paperwork for federal disaster assistance. We are very encouraged to see Missouri communities pursuing these federal funds to keep moving forward. For more information, go to sema.dps.mo.gov. Again, that's sema.dps.mo.gov. Again, I want to say thanks to everything that our partners are doing in response to this and pledge that we will continue working for PPE for everyone. And I want to encourage everyone to stay safe and healthy. Thank you.
Director, thank you very much. Thank you for what you're doing over there. And just to add on what the director said on PPE, I also want to thank the Missouri companies that have stepped forward to help us with that PPE issue across. Ever since this virus has started, they've stepped up to help us, and I'm just so thankful for so many organizations in the state of Missouri that helped us in such a time of need. And again, it just goes to prove the hard work values of Missouri and what we'll do when our back's against the wall for one another to help with each other. From the severe impact on public health and the economy to Missouri's day-to-day life, everything in between, COVID-19 has had a far-reaching impact on our state. Like many businesses and industries during this time, Missouri's transit systems are facing challenges as a result of COVID-19, especially in rural Missouri. I'm happy to announce that Missouri is the first state in the nation to receive a federal grant for rural transit as part of the national COVID-19 relief efforts. Yesterday, the United States Department of Transportation Federal Transit Administration announced a $61.7 million grant to the Missouri Department of Transportation as part of the CARES Act signed by President Trump. These funds will provide a much-needed boost to rural transit systems in Missouri, as many have reduced services due to the COVID-19 crisis. And I want to thank Secretary Choi, Congressman Sam Graves, Senators Roy Blunt and Josh Hawley, and the remainder of our federal delegation for their role in obtaining these funds that are so important to the future of our state. This relief will help keep Missourians' rural transit systems operating into the future. Another area that continues to be a concern is unemployment. Yesterday, the Missouri Department of Labor began issuing the $600 federal unemployment supplement payments with a total of $66 million in benefits paid out to over 115,000 Missourians. Eligible claimants should begin receiving payments within the next few days. Unemployment claims are at historical highs, but the Missouri Department of Labor is working each and every day to meet this challenge, and I'm very proud of their hard work and commitment to Missourians. In addition to hiring temporary workers, the department is using staff across all divisions to help with the increased work volume and process claims as quickly as possible. On the technology side, the department has increased its online capacity and is working with private vendors to assist with the call center. And I want to thank Director Hugh and the entire department for their continued efforts to assist Missourians during this difficult time. With so much of our daily discussion centered around COVID-19, it's easy to lose sight of the positive things happening around us. And I'm so proud of how Missourians have pulled together to help and find solutions during this time of crisis, including our healthcare system. As I said yesterday, our hospitals across the state responded to COVID-19 without hesitation. From converting ICU beds to training healthcare personnel and establishing remote testing sites, they have adjusted operations and come up with creative ways to meet the demands of COVID-19. Truman Medical Center in Kansas City is one of the many hospitals thinking outside of the box and making innovative changes in the face of this challenge. Today, Truman Medical Center's President and CEO, Charlie Shields, more about the creative steps they have taken to stay ahead of the COVID-19 curve. Charlie?
Thank you, Governor, and just on behalf of Truman Medical Centers, but more importantly from all Missourians, thank you and your staff for your leadership on this really tough issue that we're facing right now. I am proud to be the CEO of a health system that thinks outside the box and furiously coming up with new ways of doing things to keep ahead of this COVID curve. That health system is Truman Medical Centers University Health. We are a large, urban safety net hospital providing quality care to those with the best insurance or those with no insurance at all. We're testing COVID patients every day. So far, we have tested a little bit over 1,700 patients, and we are preparing for more. We've revised our operations dramatically. I know that at Truman, we are not alone. Every hospital in this state is doing the same thing, making innovative changes, sometimes big changes in a short period of time. And frankly, that is not how hospitals usually work. But we're adapting to this, and we hope that carries us forward in the future. So I thought I would give you a few examples. So we have a 5-foot-tall disinfecting robot that we use to disinfect rooms on a daily basis using ultraviolet light. We discovered through some research that that same exact robot can be used to disinfect N95 masks, which has been mentioned is the most difficult type of personal protective equipment to source. At Truman Medical Centers, employees wearing the N95 mask, which is this, would normally dispose of those after one interaction with one patient. A nurse could go through 10 N95s in a single shift. During this pandemic, we are covering those N95s with a protective barrier mask. And these are disposable and they're relatively easy to source so that healthcare workers can serve multiple patients wearing the same N95. At the end of the day, those N95s are then disinfected by that UV robot that I talked about, and each frontline worker's mask is returned, their individual mask is returned to them at the beginning of their next shift. Our lab, and we've talked a lot about testing, our lab has been equally innovative. So in the beginning, testing kits were hard to come by. So we figured out how to make our own testing kits using swabs that absolutely work but haven't traditionally been used for viral sampling, along with saline as a medium, which works perfectly, as well as the testing is in-house and has a quick turnaround time. We're working with the community to create much-needed materials also. For example, Cerner, which is one of our great Missouri companies, is sending us frames, and we're using those to make our eye protection. They have a 3D printer, and they're cranking them out. The Kansas City Art Institute, which is one of our great higher education institutions in Kansas City, has reached out and said they want to make the full protective face shields for us with their 3D printer. The other ways hospitals are making quick changes to respond to COVID is drive-through testing. We have 2 testing stations at our hospitals. People simply drive up, nurses in full protective gear go out and conduct the test. We've identified people who can do jobs other than the ones they've typically been trained for. Example, we have earmarked people who can work in the ICU but haven't traditionally done so on the doctor and nurse side. Our staff help sterilize door handles and sterilize the entire hospital and handrails in the hospital on a daily basis. We're actually sourcing materials from new vendors that we've never considered before. Vendors like Ace Hardware and Home Depot aren't typically vendors that you get hospital supplies from, but we are today. For our new moms, we are creating virtual visits and tours of our mother-baby units for those expectant mothers. That's something we have never done before. And every day we have a pool of 25 nurses who answer our COVID phone hotline. We stood up a call center in a conference room. We started with 1 nurse, and now it has grown to 25 because of that demand, and they are answering questions every day on behalf of our citizens. I know some people have referred to this as the calm before the storm. I can tell you that in some ways, hospital leaders and staff throughout the state are busier than ever preparing for a potential surge that might be ahead of us. We certainly don't have all the answers, but we know that ingenuity and good old Missouri craftsmanship may be enough to gain some of the PPE that we need. It may not be all, but we will head in the right direction. I can tell you the hospitals are doing this every single day, and we are proud to serve Missourians and be part of the team. Governor, thank you for all you're doing. Thank you for all your staff is doing. We are happy to help and assist, and we're happy to share the message today. Thank you.
Charlie, thank you very much, and thanks for sharing that today. I think one of the things, I just got off the phone with the Vice President before I come out to this briefing today, and one of the things that he was talking about, just for the first to know, is the elective surgery. They're really wanting to get back to that, to get the hospitals back open where they can do more things than just absolutely the COVID-19 crisis. And the other thing I want to talk about, just mention about what Charlie said, some of the things that they've come up with and they've made on their own. One of the things we knew early on, all of us did on the conference calls with the hospital and the governor's office and many other people around the state, we knew we were going to have to rely on ourselves, and we were going to have to figure out solutions here in Missouri, because we knew the problems that already exist on the federal level, and we knew at the end of the day we were going to have to take care of ourselves. And I think today is a perfect example what these hospitals have done around the state to take care of their own employees, to make it safe, and to the people going in those hospitals. And again, I've never seen such ingenuity, I guess I want to say, for what the hospitals and everybody's did around the state as far as coming up with ideas and how do we do it better on our own and not dependent on other people, and I thank them for that. Kelly, questions?
Yes, we have several today, Governor Parson. The first one is from Caitlin Shalhorn from the Missouri Times. Senator Caleb Rowden announced the Missouri legislature is tentatively looking to return to session on April 27th. What, if any, role did you have in this plan?
Well, I think that's a legislative's issue when they come back or not. I'm glad they're coming back. I think there's work to be done here at the state capitol, so I think it's good. I think they're essential. I think everybody should have a right to be represented right now with the challenges we face, one, with the federal stimulus coming, but two, looking forward, and everybody needs that representation right now. So I think as long as they abide by the rules, and be careful on the safety issues, on the social distancing, I think it's going to be fine for them to come back and go to work.
All right, so a couple of follow-up questions regarding the same topic from Kurt Erickson, St. Louis Post-Dispatch. Are you concerned about them coming back too early in the midst of this pandemic?
I think if they follow the rules and follow the social distancing and do what they did last time, they had a pretty good plan. It looked like to me that everything went well. But look, we talk about essential people out there that's got to go to work. I mean, the legislatures have got to take a part in that. Constitution says we got to pass a budget by the end of June. So we got to figure out ways to do that. So I think it'll be good for them to come back and try to finish up what they can.
All right, and Kurt also asked, besides getting the budget done, what are your top 3 non-budget priorities for the legislator?
Well, I think right now, when I'm talking to legislators right now, you need to say COVID-19's front and center. But I think the other thing we're looking at is how do we restart the economy? How do I take care of 200,000 people, if not be 300,000 before this is over, or 400,000 that's lost their jobs on unemployment? Those are the priorities right now of the state, and I hope that's for all the legislators going forward, because we got to get the economy going. When we get that, where people feel like it's safe again to go out there and be part of it, we got to do that, and we got to get people back to work. Because if we don't do those two things, I'm not saying most of the rest of the priorities are not going to matter much.
All right, thank you, Governor. This question is from Brian Locke, KMBZ. Hundreds of millions of dollars are being spent right now. How is this all going to be paid for? Is Missouri's deficit going to be sky high?
Well, it's going to be a challenge, to say the least. We know revenues is down, but, we have had put some money back. We've saved some money over the past. We had $100 million that we put away last year, and we had that money to fall back on, so that's going to help. We're going to hope the stimulus money that comes in is going to help with that. But at the end of the day, however you look at it, there is a huge amount of taxpayer dollar, regardless where it comes from, whether it's the federal government or the state. It's people's money out there, and it's going to be a challenge in the future, and everybody's going to have to understand that we're probably just not going to go back to normal financially, just like so many other regular people out there in Missouri. It's going to take us a while to get our feet back underneath us and be able to generate the kind of revenues we was before this happened.
All right, Brian also asked, Governor, how is your campaign being affected by the outbreak of COVID-19?
We haven't done anything on the campaign. I haven't even been involved in the campaign for well over 30 days now. I mean, the only thing I'm worried about today is being the governor of the state of Missouri, trying to figure out how I deal with COVID-19, how I deal with the economy, and how do I do my job as a public servant. That's the only thing I'm worried about today. The campaign will take care of itself in the future.
All right, thank you, Governor. This one is from Melissa Greenstein, KSHB TV. After the death Monday of a Kansas City, Missouri firefighter due to COVID-19, are you re-examining whether local fire departments have adequate PPE?
I think we're all trying to do everything we can. And first, just my heart goes out to him and his family for the loss that we've received in this state, and for all of us that received that, for him losing his life as a fireman. But every day, I think the firemen across this state, the individual departments, we as in the state government are trying to figure out ways to make sure we get the equipment they need to do their jobs every day. But I'll go back to what the director said. Every state, everyone in the country is fighting that battle, trying to get that out there. And we're just going to have to do the best we can to get that gear to our first-line responders, and we'll continue to do that. It's just going to be unfortunate, that we're not going to be able to do all of it at once like we would like to.
All right, thank you, Governor. This question is from Zach Boeto from KMIZ. Governor, when can we expect to see concerts start back up in Missouri?
Well, first of all, I'd probably suggest play the radio. Is what I would do. I don't know when we're going to see concerts back up. I hope sometime in the near future, but the reality of it is, I don't think that's a priority right now for the state of Missouri. And we hope this summer things change. We hope in a couple more months we'll be able to talk about those things. But right now, I don't think that's probably on the priority of list to be dealing with.
All right, thank you, Governor. This one is from Lauren Traeger from KMOV. I'm wondering if there's a breakdown of how much CARES Act funding the state expects to receive or has already received, which agencies have or will be receiving it, and how the governor plans on safeguarding that it is allocated properly.
Yeah, I think that's what we did last week with the state treasurer, Fitzpatrick, coming in. I mean, here's a guy that's got budget experience in House of Representative Appropriations. We're going to be using him in an advisory role with some other people to say, how is this money to be spent? How are we going to get it distributed as soon as we can? And then really, what's the guidelines of the federal government? Because, that's always going to be attached to it, and we just got to go through that process. But I think the thing we're really focusing on here is how are we going to disperse the money to what departments and who's the priorities of that. And, and at the end of the day, how quick can we get that out the door to the people out there that need it in the worst way?
All right, thank you. This question, he's got a couple from John O'Sullivan, KMOV. Governor, do you have faith in State Auditor Galloway being the watchdog of these funds?
The state auditor will have a role to play. When this is all over, she's going to go back and she's going to be able to audit these accounts that we're dealing with. But until that day comes right now, we're going to continue to do what we do from the governor's office, and her duties will come later on.
All right, Governor, there are talks in other parts of the country of easing restrictions in the coming weeks. Are you looking to do that or extending the statewide stay-at-home Missouri plan?
We're in constant communications with people around the state trying to figure out what are we going to do when these dates are going to be lifted, and how are we going to get there, and what is that plan? We're working on that every day as we're in here at the governor's office trying to figure out what is the best avenue to move forward. Again, I'm going to go back to what I've said all along. We're going to look at Missouri data to figure out how we're going to make those decisions and where these cases are, where's the hot spot areas, and how do we get pieces, and probably will be pieces, how do we start the economy going back up? And that'll probably be more in phases if I was guessing. But again, it's looking at the data, it'll be talking to people and trying to figure out how we move forward on that.
All right, this question is from Elizabeth Hoffman, KRCG 13. With the major spike in unemployment, many Missourians have expressed difficulty getting unemployment benefits. What is being done to accommodate the increase in unemployment applications, and what advice do you have for those who are waiting on funds?
Yeah, look, we're going to get to you. We're going to get to you if you're not one of the ones that's got in yet. We're bringing people in every day, trying to meet the demands of that. And I go back, and you can't use this for an excuse forever, but there is just record numbers of people filing for unemployment that we've never seen before in the history of our state. And we're just dealing with that as well as we can every day. We've went to outside sources across the state of Missouri to get people to come in and help us with that. And again, I know I'm the governor of the state of Missouri telling you this, but when I look around, I talk to other governors of the state, Missouri is much better off than what many of these other states are trying to deal with this, because the problem exists everywhere. We were just fortunate to be a little bit ahead of it than most states were. So right now, we got work to do, and we got to get better at it. And I think all of us know that. But we're going to continue to get better, and we're going to make sure the people that are filing those claims are going to get those claims processed, and they're going to get that unemployment check as soon as we can get it to them.
All right, thank you, Governor. This question is from Philip Sitter, Jefferson City News Tribune. Governor, what is the status of the state's advisory group on how to spend federal aid coming to the state? Is it waiting to receive the federal guidance before proceeding?
Well, I think right now that no, they're not waiting on nothing other than they're in the process right now. But every day we're receiving funds. Some of them I mentioned to you earlier today. But funds are coming in the state of Missouri all the time, and we're just trying to make sure what are those guidelines and how do we distribute that money, and how do we get it out the door. I mean, that's what we're focused on. That's what they're focused on. And again, this is happening at a very fast pace. It's never been done like this before, so there's adjustments all the time to making it. But again, the priority of this administration and that advisory group is to get those guidelines set and get that out to the people that need the resources in the worst way.
All right, thank you, Governor. This question is from Lucas Geisler, ABC 17. Senator Blunt announced $208 million for K-12 schools yesterday through the CARES Act. More money for education is expected this week for the governor's discretion to spend. What are your personal priorities spending federal money for K-12 education?
Yeah, part of that will go through the advisory group again, that we're trying to figure out what is the best resources they need and what is it. We'll be working with DESE out there to figure out a plan on that, to work with them to know what are the needs of those schools out there and how do we really best spend that money. How do we better get that out to work? Because we got a lot of things out there we got to figure out. We got to figure out what we're going to do with summer school. How are we going to finish out the year with the kids, and what are we going to have to do about the startup date for next year? So there's a lot of things that come into that answer to that question. But again, that's going to go through an advisory group, and we'll figure out, working with DESE and the local levels, of how to best spend that money and how to get it out there.
Okay, thank you. This question is from Dave Helling, Kansas City Star. You may have noticed that governors from several states in the Northeast are talking about a coordinated response to lifting the stay-at-home order and other emergency declarations that the CV threat eases. Has Governor Parson been in contact with Governor Laura Kelly to talk about a similar coordination of effort?
I know my chief of staff has talked to her chief of staff about that very issue, and then I was on a call last night with several other governors across the United States talking about such things as that. But look, I think at the end of the day, you're going to have to put your state first above everybody else and see what's the best for our state. Missouri is so diverse, and the way we're set up in this state is totally different than a lot of other states. So we're going to approach that from what's best for the state of Missouri. It's not so much what every other governor wants to do or trying to become one pack to decide how you do that. I got to take care of Missourians, and I'm going to look at our state, and it's going to be the priority. So I'm not sure what that date's going to be, but we'll be in conversation with other governors how to move forward.
All right, thank you. This question, Governor, is from Jason Hancock, Kansas City Star. Governor Parson, do you believe the COVID-19 pandemic or abiding by a government-issued stay-at-home order is a valid excuse for Missourians to request and cast an absentee ballot?
I do not. Look, the absentee ballot is more of a political issue than it is anything. This is a Democrat-Republican issue, and that's where this is all headed, is to a political answer and what's driving behind this force. Right now, it's about being prepared for COVID-19, doing what we can for that. It's about getting the economy started back up. It's about people going back to work. There'll be time to talk about the elections in November and August, but now's not the time for that. There'll be time for that.
All right, and the final question for you today, Governor Parson, is from Jacqueline Driscoll, St. Louis Public Radio. Today it was announced that Missouri is going to receive $66.5 million through the Child Care and Development Block Grant. The supplemental budget has passed by lawmaker includes about $20 million of that to be spent by July 1. Can you provide any details as how that money will be used?
Yeah, I think what we're really looking at is how do we expand to child care across the state? How do we do that for first responders? How do we expand the hours of these providers out there? How do we be able to help them that they can provide more services, what that's for? And how do we give people access to daycare that's out there working every day on the front line? So that's what that money is going to be used for, and we're just going to have to figure out what's the best way to spend that money for that. But again, it's expanding the system, making daycare more available to a lot of different people for a lot of different reasons.
All right, thank you. The next couple of questions will be for Dr. Williams. Dr. Williams, this question is from Madison from the Missourian. As the technology to reduce testing time has improved, what is the average wait time it takes to get results from both the state lab and the private labs in Missouri?
Madison, thanks for asking that question. I thought about that the other day because there's a wide variation. You know, and I practiced for 30 years. I had 3,000 patients, and I vividly remember that the longer it took for a test to come back, people just inherently think it must be abnormal if it's taking that long, and they might hear a friend got theirs back. But I think it's just human nature to think, uh-oh, they found something. And so what I would strongly encourage you to do is when you get your test, wherever, at either one of our academic or commercial or the state lab, to ask, in your experience, how quick are these tests coming back? I was talking to Charlie before he walked in here, and even one of our national labs I've heard has taken up to 9 days, but he's getting labs back from that tests back from that lab in a day. Certainly our state lab, our turnaround is absolutely 24 hours. We get them back the next day. And I know in some other commercial labs, they get them back the same day. So I would encourage patients, just because it's taking longer doesn't mean it's bad news. And to ask wherever you get your lab, we're now up to about 14 labs, including hospitals, I think, that are doing tests. And as the governor said, this is just integral to our approach moving forward, even as we go into recovery. It's just so important that we're developing a very robust, increasingly evolving testing capacity. Just ask your clinician, your provider, when do these usually come back for you?
All right, Dr. Williams, thank you. This question, he has two for you. Joe Gamm from the Jefferson City News Tribune. Why has Missouri chosen not to require that medical providers give detailed demographics about COVID-19 victims?
Joe, we do. It's required by law. But to your point, when we look at our data, we only get that about, I think it's 60% of the time, 69% of the time. So we are going back and trying to retrieve it by looking at case by case. And I will say that going forward, it looks like once we put out that notice about 2 weeks ago, that is improving. But we think that's incredibly important because right from the get-go, each of these emerging pathogens, whether it's Zika or H1N1 or COVID-19, is different. We knew about this one right from the get-go, that it had a propensity in congregated settings like nursing homes to spread very quickly. And then subsequently, we've learned that there are certain populations that are more vulnerable, such as African American. And so we constantly, as the governor said yesterday, you have to be nimble if you're going to do this, and you have to have situational awareness and react to new information.
Okay, thank you.
Thank you.
All right, Director Karsten. I have a couple for you. This first one, Director Karsten, is from Caitlin Shalhorn from the Missouri Times. Following up on the recall of masks, where did the mask come from?
The mask that we have recalled came in 2 different shipments from China. There were 3 different factories in China. I do not have their names, but 3 different factories in China were responsible for their manufacturing.
Can first responders expect to receive new supplies?
Yes, and as I mentioned earlier, the shipment that FEMA is sending to us of N95 masks will be made available to first responders as well as law enforcement across the state as soon as we can get them out.
Okay, and the final question for today, Director Karsten, this one also is from Caitlin Shalhorn from the Missouri Times. She asked, has DPS made any decisions regarding the sale of mixed drinks to go by bars and restaurants?
Yes, just this afternoon it's being announced, if it hasn't been while we've been at this press conference, that the Missouri Division of Alcohol and Tobacco Control will temporarily waive some restrictions on the sale of alcohol in containers besides their original packaging. This will include allowing the sale of alcohol containers that are durable, leak-proof, and sealable, and they must meet the minimum size requirements of the Code of State Regulations. The other requirement is the customer must have ordered and purchased a meal simultaneous for the alcohol beverage to be purchased. So the other one is the sealed alcohol container must either be placed in a one-time use, tamper-proof, transparent bag, which must be securely sealed, or the container opening must be sealed with tamper-proof tape. So again, this change is being done to assist restaurant owners as well as their employees during this time of unprecedented restrictions. We are waiving that temporarily to allow for some of those situations to occur. So I do want to remind folks that there are open container laws across the state, and we need to make sure that those folks that are buying these types of beverages are complying with that. I also want to remind everyone that we take very seriously drunk driving, and we would encourage everyone to be safe on the highways after purchasing some of these beverages. So thank you.
You know, before I go to closing comments today, as I listened to the speakers today, I listened to Charlie come up here on the hospital side, the PPE discussion that Director Carson talks about so much, Dr. Williams. You know, I remember when we first started out with the COVID-19 and everybody, definitely was a challenging time. People were saying we were going to run out of test kits in 2 or 3 days. We were going to run out of PPE gear in less than just a few days. We wasn't going to have the supplies we needed, that all things were going to fall apart. And the reality of it, here we stand today, still challenges to be had in all those categories, but we have met the demand day after day after day with people working hard, people trying to find solutions, and we continue to grow on those issues, trying to do a better job at PPE and a better job at the testing that we're doing in the state of Missouri. And we continue to get better every day with that when you see that. So I think it's important sometimes we talk about all the problems we have with COVID-19, but a lot of good things have happened, a lot of good things to come. And I think we're going to be talking about some more of those things in the days to come. But I think it's important to point that out, a lot of the successes that we've had fighting this virus from day one to where we are today. Again, I thank you to all Missourians for their commitment to doing the right thing and following our Stay Home Missouri order. Each day we are closer to winning this battle, and we must remain aggressive in our efforts to continue slowing the spread of COVID-19. Now is the time to continue social distancing and staying home as much as possible. We will overcome this, but we need everyone to continue making smart choices, being responsible, and following the stay-home order. Because at the end of the day, that is how we will stop the spread of COVID-19. Thank you, and God bless.